Thank you, everyone, being here. And a special thanks to UnityPoint and Muscatine Library to provide this meeting together. A special thanks to Angie make this happen. And I'm trying to make it very simple. And I try to avoid those emotional aspects. Dementia is sad disease, breaking hearts, breaking families, bringing a lot of emotions, and sometimes destroying families. I saw lots of ugly faces of dementia, and I didn't know how bad it is until my father, my hero, developed that. And I was trying to help him, goes back 10 years ago. When I was trying to help him, I realized how much I don't know. And I was trying to digging in more and more, and I realized I don't know much. And I was trying to help him. I lost him last year, but he remembered my name and my face until last week of his life. And that's the reason I'm here. My message is very simple. If you guys leaving this building with two things, I meeting my objectives. I want everybody to be hopeful, and we all have power to do something to make it better. No guarantee. Why brain? Why I didn't make a topic for diabetes or high blood pressure or heart disease? If you guys have the best diabetic doctor and you don't remember to take your insulin or your medication, does not help. If you have the best heart doctor and you don't take medication, it doesn't help. If you have the best lung doctor, but you don't remember to fill up the tank of oxygen, you are going to be short of breath. If you remember all of it, but if you remember don't turn off the oven, you are not safe at home. If you want to be healthy, the human health is upside down. This is the captain. This is the CEO of the brain, and we have to provide healthy brain first. I have one promise tonight. It's very simple, but it's not easy. And when you're leaving this building, your concept about dementia and Alzheimer never would be the same. I'm going to address three things: what it is, how bad is the situation in the country and globally, and what we can do. First, I explain, sometimes people say, what is it? There is an umbrella of brain disease, lots of disease. Is Parkinson's disease, MS, ALS, lots of it. One of them is dementia. Dementia has their own umbrella and has lots of different types of dementia. Vascular dementia, Lewy body dementia, frontotemporal dementia. One of them, most common one, is Alzheimer. So if somebody talking about Alzheimer, is the most common type of dementia, and dementia is one of the brain disease. We are talking about Alzheimer tonight. Left side is Dr. Alzheimer. He was a pathologist and he was a psychiatrist 100 years ago. Right hand, it was a lady with behavioral issues, some memory issues. When she passed, he was examining her brain, noticing some lesion in the brain, and he made the name plaque and tangle, and he mentioned these plaque and tangle as a lesion making brain die and brain shrink and people developing memory problem. He put his name on it, and he put Alzheimer's disease. For more than 100 years, all of scientists with $billions of money, they were focusing on that lesion, plaque, tangle, and volume loss, and basically brain atrophy. They were trying to find medication, how they can decrease formation of plaque, how they can clean it up so the brain does not developing dementia. No success. We have no medication. More than 400 trials, all failed. Whatever we have Namenda, we have Aricept, we have some medicine. The best case scenario doesn't help. There is no medication right now. So since few decades ago, all of the researchers, they start asking one fundamental question. They were saying, maybe we are looking wrong place, and maybe we were asking wrong questions. They studied, they did research, and now they have new concept. They were saying maybe memory problem, Alzheimer, and dementia is starting somewhere else, outside of the brain. And maybe those lesions are side effect of underlying problem that we have to fix that. They started some research, and the data and the results are promising. There is working now. What's the whole concept? The concept is inflammation. We're all familiar with inflammation in some degree. We have two types of inflammation, acute and chronic. Acute inflammation, we all know, itching, asthma attack, bee stings, is red, is swollen, is painful, and is basically a lot of systemic effects just out of the blue, just sudden. But they are talking about chronic inflammation. We don't see it, but is sneaking on us. Maybe showing like abdominal pain, maybe fatigue, maybe headache, and one presentation, maybe memory problem and dementia and Alzheimer. Now they are saying every chronic disease, from diabetes, high blood pressure, you name it, there is a fingerprint of inflammation. We fix inflammation, that inflammation goes down, symptom gets better. That inflammation, if happen to insulin signaling system in the pancreas, causing diabetes. If it's happening to the vascular system, causing high blood pressure. If it's happening to the brain, causing neuroinflammation, inflammation of the brain with fatigue, headache, and fogginess and memory problem. This is not simple on and off switch. This is very complex and look like this. And Dr. Burdison, who working 35 years for this Alzheimer, he is metaphorically saying is a roof with 36 holes. If you have 35 holes fixed, just one hole's left, you still have a roof with leak. And another scientist saying if you have 100 nails on your chair, if you take 99 of those nails out, just one nail left, you cannot sit on it. It's painful. We have to fix all of it. We have to decrease inflammation, every single aspect. It could be infection, it could be mold, it could be a stress, it could be a stressful coworkers, it could be bad workplace that we are working, it could be milk that I'm drinking causing inflammation, it could be lots of things, and we have to find out and address that. It could be stress, it could be food, it could be environmental toxins, it could be lack of sleep, it could be contamination in our water or our food. I categorize three groups. If you are in green zone, good for you. Keep working, stay sharp. If you are like me in orange zone, you have to have more homeworks to do. You have to do more. And if somebody is in red zone, don't be hopeless. Still, we can do something to make it in some degree better. When I see patients in the clinic, always I ask them, hey, did you do colonoscopy? Did you do your mammogram? Did you do your pap smear? Why we are doing that? Why we are doing pap smear or mammogram? We are going to prevent from cancer. And why we are saying, hey, you don't have diabetes, but you're heading, you have impaired fasting glucose. If the patient has high blood pressure, we are saying you're pre-hypertension. You don't have blood pressure, but you're getting there. Be careful. We don't have this pre-dementia. This is very important. One thing I wanted to say is very important, especially female. Every 3 people with dementia, 2 of them are female because of complexity of their hormones. And if I don't have any symptoms right now, it doesn't mean I don't have dementia. When the symptoms start in the brain and I'm noticing it, sometimes it's 3 decades. 3 decades, 30 years. Maybe all of us have some piece of it. And all of us, we have to work on that. Because when we have these symptoms, unfortunately, we have social stigma. If I have a problem, I hide it. I don't want my kids or my wife or my doctors for sure, they don't want to know. Because they are losing driving license, they are losing their independency, they are losing their freedom. So they hide it until wife noticing it, until family noticing it, and we are losing that golden time. When we have a stroke, we all trained. We call 911 because from the time it started, I have 180 minutes to save it, 3 hours. For dementia, we have 30 years, but we are not doing good job because we lose that golden time. If somebody has moments of missing car keys, is no senior moments. Then there is no such a thing. We have to do something right away. When we're born, we have basically development as a young adult, we start declining. We always have time. The body is amazing to reverse until a certain point. After that entropy point, is very difficult body reverse. So the businessmen, they are saying location, location, location. In dementia and Alzheimer, timing, timing, timing. We have to act fast and sooner than we think. How bad is the situation? Every 65 seconds in this country and every 3 seconds globally, somebody developing dementia. And every 3 seniors in this country, one of them dying from Alzheimer. For last 20 years, all of those work that doctors did, they decreased mortality for heart disease 7%, some people saying 14%. Mortality for dementia and Alzheimer increased 145%, almost doubled. And right now is the sixth leading cause of death. Next 10 years, dementia is gonna be fourth leading cause of death. We all worry about men with prostate cancer and women with breast cancer. Alzheimer kills more Americans than breast cancer and prostate cancer combined. Cost. If I stay in my own home, probably all of us paid that mortgage when we are seniors, and I'm in my recliner with my family, and costs nothing, it's free. But if I go to nursing home today, semi-private is $95,000 per year. Private is $107,000 per year. 2030 is gonna be $400 per day, $16 per hour. So if you wanna be rich and stay rich, you have to be sharp. Two things I wanted to mention, then I talk about what we can do. One is about genes. Some people are saying, my mom has it, my aunt has it, my grandma has it, I'm gonna have it. Yes, there is some genes, there is some association. But genes, they are saying, loading the gun, what we are doing, my lifestyle, is gonna pull the trigger. What's the highest gene for dementia on the earth is in Nigeria. They have the highest frequency of their genes. They have the lowest rate of dementia. Why? Because of lifestyle. So genes is not our destiny. We are not doomed for that consequences. We can change that. So am I saying with all of those billions of dollars they spend, we can do something like better sleep or some lifestyle changes, we can make the situation better? Yes, I'm saying that. So why nobody is talking about that? There is a significant gap in this country and everywhere between research and clinic. I didn't know 10 years ago. And I was going to Lutheran homes, seeing patients with dementia. I'm saying I was guilty, I didn't know. Until my dad developed that, and I was trying to help him. And I reaching to that side. They were trying with some policies, closing this gap they call translational research. The gap right now is 17 years. So there is some information in this side. It takes 17 years coming to my clinic, they teach me, and I take care of my patient. Do we have 17 years to wait? I don't. And we have to do it now. And there is nothing new. And we think this stuff is new. No, there is a movement in East and West. They are coming, they are saying we have survivors of Alzheimer. We can end Alzheimer's. But unfortunately in Midwest, we are more pale and we don't have those information and those clinics, and we have to work together to make it situation better. And that's why we are providing those type of meetings. And I'm hoping we come up with those serial talks. Next month, I think, is in the same place. We are talking about how movement and exercise can prevent dementia. Next one is going to be about the sleep, and then stress or nutrition. There is not new information here that I'm saying. This is all established, just I'm here to tell you guys, and we have to publicly spread those information. As I said, it's simple and it's not very easy. There is no lack of knowledge. Sometimes it's lack of behavior and those acts. It's 3 phases. Number 1, we have to weed out. If it's bad food, bad coworkers, lack of sleep, immobility, bad food, we have to get it out. We cannot cheat. Very straightforward. Take weeds out. Next stage, seeds in. Better food, better nutrition, better sleep, be mindful, better relationship, and keep moving and keep learning. And it's difficult. This stage is most difficult one. We have to nurture it. It's not just a matter of 1 year. It's lifestyle until the last day of our life. And I'm going to different stage what we can do. Number 1 is about oral health. For long time, we know about oral health and cardiac issues. If somebody has oral problem, they have higher chance for cardiovascular and heart attack. We didn't know about oral health, a strong association and even causation of Alzheimer. First step, we have to have optimal oral health. Number 2, sleep. That's the problem. There is no medication as a sleep aid. None of them is gonna basically help you long-term with no side effect. All of them have side effect. One thing I wanted to ask you, if there is something they are saying Tylenol PM or Advil PM, that PM part is Benadryl. That Benadryl, after 65 years, in the many criteria of textbook, they are saying don't give it because long-term as anticholinergic medication causing memory problem. All of the medication, even melatonin, long-term affecting us. We have to sleep. Sleep is the cheapest prescription for us. The doctors, I think this is the first line of defense for memory care. If I wanted to have a good day, I have to have a good night. Good day starting with good nights. And when we are sleeping, our brain working hard. All of the janitors, all of the immune system of the brain, they go there, clean it up. All of those plaque and tangle, they wash it out, dust it up, and flushing in the toilet, they call the lymphatic system. So if you have a deep sleep, the next morning you're fresh, you're clean, you're ready to go. But if I don't sleep, the next morning look like I have 100 cotton ball in my head, I'm foggy, and I'm tired, I'm fatigued, and the body translating my fatigue to hunger, so I'm not eating well too. But unfortunately, in this country, because of that modern lifestyle that we have, we all socially jet lag. We are staying late, and all of us, we are compromising our sleep. Sleep is the first line of defense. Has lots of effect. Balancing hormones, generating nerves, but one thing, cleaning your brain. In sleep talk, I'm going to making those points how we can program ourselves to sleep better. I'm victim of this sleep because I worked in emergency room in a decades at night until I got sick, and I'm realizing how important it is. Some countries, they are giving to their night workers cancer insurance. And some places, especially for female, they are giving extra money. In London, in England, they didn't approve in the Congress. In the United States, even they didn't let come to the Congress. They rejected. Sleep, lack of sleep, causing dementia, causing cancer, causing lots of chronic disease. The first prescription, sleep good. Sleep apnea is emergency in the United States, is underdiagnosed, undertreated. If I have a sleep apnea and I don't know, I'm going to age fast. I'm going to get rinsed, oxidized, because when I'm sleeping, my brain doesn't receive oxygen. My brain is 3 pounds, 2% of my body, using 20% of energy. 20% of energy need oxygen. When you don't have that oxygen, the brain cells die, brain shrink, memory goes away. This car has no sleep apnea. That car has a sleep apnea, remember. And many people have hesitation for a sleep study. I know they have to go to hospital, but sometimes they can do at home in their own bed. Sometimes it's expensive. You can easily do this, basically order in Amazon from $30, $50, $60. You can check yourself, load it in your computer or cell phone, see how is your oxygen. Oxygen should be around 94 all the time. If it goes below 90, you are in danger. You have to fix that. Number 3, exercise. If we want to keep balance, we have to keep moving. All exercises are good. What's the best exercise? We have the best data for cardiac. But whatever exercise you're comfortable, whatever exercise you do the most is the best exercise. Just keep moving. Has lots of benefit. One thing I'm going to mention, increasing BDNF, brain drive neurotrophic factor, they call miracle groove, look like flourishing the nerves. Left side is your nerve with BDNF, with exercise. Right hand is without BDNF. Exercise, bringing BDNF high, so you have better memory and better concentration. Next number is stress. We're all familiar with. This is something we all suffer, especially for last few years. After this COVID, all of us, we had punches, left and right. We lost family member. We lost our social connection, some financial issues, lots of issues. And our stress goes up. That's why parallel dementia in this country also goes up. We cannot eliminate stress. We all have it. What we can do, if I have an autistic kid, I cannot eliminate my stress, but I have to somehow not reacting to that stress. I have to learn to respond to that stress. And we are going to talk about mindfulness and how we developing those skills, especially in modern life that we have. Stress increasing cortisol, cortisol causing weight gain, cortisol causing brain shrink. Simple. If you want to have your brain not be shrinking, you have to keep your stress down. Nutrition. Few things. We can talk about this nutrition days. Brain, food, is 10% carbs. Carbs, I'm saying, is not fruits, is nothing sweet, is green leafy vegetable. 25 to 30% is protein. 50 to 55% is good fat. So if you want to have a healthy, sharp brain, oil it up. No canola oil, no corn oil, no vegetable oil. You have to have lots of olive oil, avocado oil, sesame oil, or very healthy, good oil. We have to avoid every simple sugar. Why? It's not simple sugar. Now they are talking about dementia as type 3 diabetes. If people have diabetes, they have 50% higher chance to developing dementia. And it's a very complex issue. As soon as that insulin sitting there and the sugars go inside, they are making the whole metabolism better. And if we don't have that, we are suffering and our brain die. This is very simple diagram. This is the signature of health. And this is the signature of any chronic disease, including dementia. What is it? If I take a simple sugar, anything sweet, ice cream, my sugars goes up, and insulin follow the sugars to bring it down. With up and down, this causes dementia. But if you have green leafy vegetable or protein or fat, they don't have up and down. It's very nice, steady sugar in the blood, and that's not a spiking insulin, and that doesn't cause dementia. Always, I say like a joke, but really it's not a joke. I say, my friends, if it's sweet, spit it out. But this is really true. We have to minimize our sugar. Toxins, especially in healthcare. They took a sample from placenta of mom is pregnant. They checked blood of the baby. Baby before first breath has 280 toxins in baby's blood. There is a CDC report. We have a healthcare providers, 12-hour shift. We have 280 exposure to chemical, many of them causing cancer. We all stuck. The food, water, air, mattresses, furnitures, we all stuck. But we cannot put ourselves in a bubble. We have to somehow minimizing those weeds and our exposure and optimizing our detoxification. How? We have to have bowel movement every day, twice better. We have to have lots of urination to detoxify. We have to have a lot of sweating to get it out. We have to move and have hyperventilation like when we are running. We have to have an infrared sauna and sweating. We have to do massage. Anything we can do to detoxify that. This is a major issue. And I stop it here, and I don't want to go further because Muscatine also is not the greatest place to live for air. Sensory stimulation. One thing before I add, when we have eye problem, with no hesitation, we go and see an eye doctor, no problem. But I see patients in the clinic, and they have some hesitation. They cannot hear you, and you're realizing that really they have hearing problem. And you ask them, there is some hesitation, and I don't know why, going and check their hearing. And hearing impairment, it could be the first sign of dementia. There is a significant correlation with dizziness, ringing in your ears, hearing problem, and end up with memory problem. Always, all of your senses that you have, you have to fix it. Best visual, auditory, sensory, taste, smell. You have to optimize all of your senses. One thing I say and move on. They did 2 groups in London. Some of them, they were bus driver. Some of them taxi driver. That bus driver going just one place from point A to point B, go back and forth. The second one was a taxi driver. He needs to find the best way, shortest way to make money more. So they did functional MRI, these 2 groups, after 6 months. Whoever was doing A and B with no thinking and routine, the hippocampus, center of the memory, shrinked. Whoever doing those taxi, the hippocampus was big. My point is, avoid routine. Take out of your comfort zone. Don't go to danger zone. Expand your comfort zone. Challenge yourself. The best sensory stimulation is dancing. You have exercise, you have to learn, you're socializing, you're connecting, stress reduction, lots of benefit. But you have to challenge yourself. If you do not challenge it, you don't change it. Last one, and don't take it very simple. It's very, very important. Sometimes people come into my clinic and they haven't seen any human being for last 6 months except who is delivering food, Meals on Wheels. And I tell them, hey, do you have any friends? They get emotional with tears, and they said, all of my friends passed. I don't have any family member. My point is, especially after COVID, when we have this social isolation, that is skyrocketing the dementia. My point is, if you have some family member, they're seniors, their eyes is 80, their ears are 80, their joints is 80, they don't have probably not too many resources, maybe they cannot drive, you can simply with one phone call or using technology to bring more connection. Every 3 people in this country, one of them, they are saying, I'm lonely. Being alone and lonely, they're different. Sometimes people, they are not alone. They have lots of friends around it, but inside they feel rejected, they feel lonely, and that causing inflammation and dementia 50% more. My point is, we have to take care of our seniors. Unfortunately, the whole dynamic and social stigma doesn't do that. This is our duty, ethical duty, to take care of our seniors better. So, to summarize that, avoid the stress, optimizing your sleep, keep moving, pay attention to your oral health, eat clean, good air, good water, good food, avoid sweet, increase your healthy fat, try to fast, avoid plastic and Teflon, cook healthy, be mindful, and keep learning. We have to all do it together, and we have to do it now.